Good morning. My name's Paula Johnston. I'm the lead inpatient diabetes nurse at Southampton Hospital.
Hi there everyone, I'm Mayank Patel. I'm a diabetes consultant also at University Hospital Southampton.
So this is your first time, Paula. What's your impression so far?
I think it's fantastic seeing all the different stands, stalls, companies. I think it's going to be fantastic, really good for peer support.
And you've been coming to these events for several years. What's your sort of feelings around why we do them and why they're important?
For me, Claire, I think it's been an absolute privilege and a pleasure supporting the charity for a number of years, as you allude to, and seeing it here on this scale at such a big setting with such a massive array of opportunities and educational things for individuals with diabetes is fantastic. And I think, we discussed earlier, I think the opportunity for people to come along, learn about diabetes in a different way, perhaps outside the traditional healthcare model setting, is really important at a time that's hopefully convenient on a weekend for some people. So seeing specialists, non-specialists, charity staff all discussing diabetes, I think, in one place is priceless.
And what's the difference between that clinical setting and something like this, do you think?
I think it's more of a relaxed environment, isn't it? There's time for people to talk to other people with diabetes as well as people from industry. So it's just more relaxed and more sociable.
And what's your presentation today?
So Paul and I were asked to discuss the importance of individuals with diabetes and those close to them knowing what should run well. So a turn of phrase used quite commonly is sick day rules. So Paul and I are looking forward to doing a session on type 1 diabetes individuals having been unwell with type 1 diabetes and discussing sick day rules. And in the afternoon I'll be discussing type 2 diabetes and being unwell and how to manage that.
And that's looking at the medication and how you manage when you're unwell, yes?
It's basically some advice, really. So, if you're not able to eat and drink, some tips and hints of what other things you may be able to take to keep your blood glucose level stable. And
knowing when to seek help, of course, if you're unwell, and don't struggle alone is the important thing to remember when you're not very well. Get help urgently if you're worried.
And is that different for type 1 and type 2, or are there some similarities?
Definitely some similarities. Yeah, there's a few differences due to some of the new medications within type 2 diabetes particularly, but generally speaking the rules are very similar.
Yeah, so some commonality but equally some differences as well. We'll cover both of them.
And that opportunity for people to come and chat to you because you're here all day long, that makes a huge difference, doesn't it?
Absolutely, yeah. Here to answer any questions and help where we can, really.
Yeah, as Paula says, it's much more relaxed. It's that outside the traditional hospital clinic setting conversation, for example. Hopefully people feel more comfortable asking what might seem a silly question. There are no silly questions about diabetes. We're happy to take any questions and look forward to meeting people today to discuss things across the day.